compliance with legal frameworks, HIPAA, GDPR, and data security laws. HIPAA, Health Insurance Portability and Accountability Act. Purpose: HIPAA is a U.S. federal law designed to protect the privacy and security of individuals' health information. It establishes standards for the secure storage, transmission, and handling of protected health information, PHI. Key provisions: Privacy Rule ensures the confidentiality and privacy of health records. It limits who can access and share PHI and mandates patient consent for the release of information. Security Rule sets standards for safeguarding electronic PHI, e-PHI. It requires healthcare organizations to implement physical, technical, and administrative safeguards to protect ePHI from unauthorized access, loss, or corruption. Breach Notification Rule requires healthcare providers and organizations to notify patients if their health data is breached. Notifications must occur within a specific time frame to ensure patient awareness. Compliance for EHRs. Healthcare providers must ensure that their EHR systems comply with HIPAA's requirements for data privacy and security, including data encryption, user authentication, and audit trails to track access to patient records. GDPR, General Data Protection Regulation. Purpose: GDPR is an EU regulation aimed at protecting the privacy and personal data of EU citizens. It applies to any organization, whether based inside or outside the EU, that processes personal data of EU citizens. Key provisions: Data protection. GDPR mandates that healthcare organizations ensure the protection of personal health data, which includes both electronic and paper records. Data access and consent. Patients must have the right to access their health data and give explicit consent for how their data is processed or shared. Right to erasure. Also known as the right to be forgotten, GDPR allows patients to request the deletion of their personal data under certain circumstances. Data breach. Notification. Healthcare organizations must notify regulatory authorities and affected individuals within 72 hours if there is a breach of personal data. Compliance for EHRs. EHR systems used by organizations that handle EU citizens' health data must adhere to GDPR's strict data privacy rules, including patient consent management and data encryption. Other data security laws, local and regional laws. In addition to HIPAA and GDPR, many countries have specific data protection laws that govern how health data is handled. For instance, countries in the Middle East, such as Saudi Arabia and the UAE, have adopted their own health data protection regulations that healthcare organizations must follow. Data localization. Some jurisdictions require that health data be stored locally within the country or region to ensure compliance with data protection laws. Compliance for EHRs. Healthcare organizations must monitor local regulations and ensure that their EHR systems are configured to meet country-specific legal requirements, including proper data storage and handling practices. Ensuring privacy and confidentiality of health information in EHRs. Data encryption, encryption at rest and in transit. One of the most important methods to protect the confidentiality of health information is by encrypting data both at rest, when stored, and in transit, when being transmitted across networks. This prevents unauthorized access to patient records during storage or while being transferred between systems. End-to-end encryption ensures that patient data is encrypted from the moment it is entered into the EHR system until it is accessed by authorized individuals. Access controls and user authentication, role-based access control, RBAC. Healthcare organizations should implement role-based access to ensure that only authorized personnel can access specific data. For example, Only doctors may have access to full medical records, while administrative staff may only access demographic information. Multi-factor authentication, MFA. To ensure that only authorized users can access EHRs, MFA is increasingly used as a security measure. It requires users to provide 2 or more verification factors, such as a password and a fingerprint or token, before accessing sensitive patient information. Audit trails. Tracking access and modifications. EHR systems should maintain an audit trail that logs all access to and modifications made to patient records. This helps healthcare organizations track who viewed or altered a record, when it happened, and why the action was taken. Audit trails are essential for identifying potential breaches and ensuring compliance with legal requirements. Monitoring user activity. Continuous monitoring of user activity within the EHR system can help identify unusual or unauthorized access, which can be flagged for investigation. Data minimization and retention. Data minimization. Healthcare providers should limit the collection and sharing of health data to only the information necessary for providing care. This principle is particularly relevant in the context of data sharing and interoperability. Retention policies. Healthcare organizations must establish and adhere to data retention policies to determine how long patient records should be kept and when they should be securely disposed of or anonymized. This is especially critical when handling large amounts of data across different systems. Electronic prescribing, consent, and patient rights. Electronic prescribing, e-prescribing. Definition: e-prescribing refers to the electronic transmission of medication orders from a healthcare provider to a pharmacy, eliminating the need for handwritten prescriptions and reducing errors. Compliance with laws. E-prescribing systems must comply with regulatory standards, e.g., HIPAA, FDA guidelines, to ensure that the prescriptions are accurate, secure, and verifiable. Patient safety. E-prescribing helps ensure that the right medication is prescribed at the right dose, minimizing the risk of medication errors. It also provides alerts for potential drug interactions or allergies. Informed consent for EHR use. Patient consent. Patients must give explicit consent for their health information to be stored in an EHR system and shared with other healthcare providers, as required by laws such as HIPAA or GDPR. The consent process should be clear, transparent, and well documented. Consent for data sharing. Healthcare organizations must obtain patient consent before sharing their EHR data with other providers, third-party vendors, or insurers. Consent should be obtained in a way that allows the patient to opt in or opt out of specific data sharing arrangements. Revocation of consent. Patients must have the right to withdraw their consent at any time, and their data should no longer be shared after consent is revoked. Patient rights. Right to access. Under HIPAA and GDPR, patients have the right to access their health records and obtain copies of their EHRs. They can also request corrections or amendments if they believe any part of their record is inaccurate. Right to request data deletion. GDPR grants patients the right to request the deletion of their personal data, including health information, under certain conditions. Right to privacy. Patients have the right to privacy, and their health information should only be accessed or shared in accordance with their consent or legal requirements. They can request that their health information not be shared with certain parties or institutions. Enhancing patient engagement with EHRs, electronic health records, EHRs, not only serve as vital tools for healthcare providers, but also play a key role in enhancing patient engagement. By giving patients access to their health information and encouraging active participation in their care, EHRs can improve patient outcomes, satisfaction, and overall health management.